There we go. We're giving it a couple of minutes to give everybody a chance to log on.
Who's that?
He needs to find the invitation he sent and click register.
Peter with Para Furniture.
He's on.
I'll send it to you.
Send you the invitation.
We'll give it one more minute.
Sure.
All right, we're going to go ahead and get started. So welcome to our live webinar with Blakeman and Associates and HRO Resources. I'm Marcus Malone, the Vice President of Sales at HRO Resources. We're looking forward to giving you some good information today. Our goal is to be efficient with the presentation so we can get through it, fairly quickly and get to the Q&A section as quick as possible. I know a lot of you are ready to ask some of your own questions. It's either at the top of your screen or the bottom. You should see a Q&A button that you can ask your questions in the Q&A area there. And then at the end of the presentation, we'll go through the Q&A questions at that point. So a little bit about HRO Resources. So we're a one-stop resource for our clients to create efficiencies and reduce costs on a broad scale across their business. Some of the key areas that we focus are employee benefits, risk management, technology, payroll, and human resources. And just kind of wanted to run through a few recent wins that we've had so far this year. And so, we work with companies from 2 employees on up into the thousands. So really we're built to scale and built to fit, a broad range of companies regardless of size and, where they are in their business life cycle. And recently, this year, we've have a few wins I wanted to cover. So we recently had a company with 30 employees, an industrial distribution company that we saved $18,000 in annual admin costs. And those costs were really around HR and payroll in those areas. And then we had a 100-employee oil and gas company that we saved over $150,000 with our multiple employer 401k plan. So our payroll clients, they have access to the multiple employer 401k plan because of the common payroll relationship that allows us to offer that. And then most recently, we had a situation with a 700-employee auto dealership where we saved $1 million in annual healthcare costs. So pretty significant. There's a lot of ways that we can help, a lot of resources we bring to the table. We'd love to be a resource for you guys if we can. I'm going to go ahead and get started with the webinar. I'm going to turn it over to Stephanie at Blakeman and Associates.
Well, hello, I'm Stephanie. I've been with Blakeman for 9 years now. We are basically an HR safety DOT consulting firm. We can help you with anything you could possibly need on the areas of HR, DOT, and safety. Today we're going to talk about the Family First Coronavirus Response Act. Most importantly, companies need to know whether it applies to them or not. If you are an employer with fewer than 500 employees, then more than likely it's going to apply. If you are an employer that is involved in the healthcare industry, that's doctors' offices, hospitals, healthcare centers, clinics, nursing facilities, retirement facilities, all employees are potentially exempt from this requirement. Same with all first responders. The Department of Labor put out a huge 88 question, frequently asked questions section that kind of discusses this so companies can find out their applicability. I know a lot of you probably have heard about an exemption that's being offered if you have fewer than 50 employees. However, that exemption has to basically come from your top executives. They're going to have to justify and show that it could jeopardize the viability of the company, their ability to make money if they grant these paid sick leaves. There's two different ones under the FFCRA is what we're going to call it from here on out for all intents and purposes. So to determine if you are a large employer over 500, you want to look at also whether you have joint employer status. For instance, a lot of these companies that are franchises, they're going to fall under joint employment status because they could have familial ownership. They could have certain rules and regs that they're overseen directly by a parent company, and that's going to make them possibly over 500 employees, which would exempt them from this act. The reason they set the limit at 500 employees is because they have the reasonable expectation that companies that have 500 or more employees usually already have a paid sick leave act in place, or they should. That's not always the case, especially when you get into like large agricultural companies, they may not have things like that. So we're going to talk about the two different types of leave. So the first one, and it's really important that you understand that these are two completely separate leaves. Okay, the emergency paid sick leave can give an employee up to 80 hours paid time off for different reasons. So some of the reasons for that qualifying leave is going to be if your employee is subject to a federal, state, or local quarantine or an isolation order. So right now, there is no mandatory quarantine in Texas unless you have done vehicle travel to Louisiana and are coming back. You must self-quarantine for 14 days. So that's going to qualify you under reason number 1. Or if you had air travel to California, Atlanta, Miami, and there's several other areas as well. So you really want to look at, if you're not in Texas, what states have those travel restrictions. These 2 weeks of up to 80 hours apply to part-time employees and full-time employees. And there's no requirement. You could have hired that person yesterday and they're going to qualify under it if they meet one of these 6 requirements. So the 6 different requirements, like I said, the first one is if you're subject to a quarantine. Number 2 is if you've been advised by a healthcare provider to self-quarantine. So basically, you teledoc or you go to an urgent care clinic, you are displaying symptoms, you have come in contact with someone, and they have reason to believe that you could possibly be carrying or beginning to suffer from symptoms of COVID-19. If you leave work to go home and you are experiencing symptoms and you are actively seeking a medical diagnosis, such as teledoc, and you're waiting test results to come back, you're going to qualify under that as well. Number 4 is if you're caring for an individual subject to an order like number 1 or number 2, which means they've been ordered to self-quarantine, or they've been by a health care provider, or a federal, state, or local order is in effect, then if you are the primary caretaker, then you are able to stay home, and that's going to be paid too at the 2/3 pay rate. The other 1, 2, and 3 is paid at your full pay rate. Number 4 is paid at 2/3 pay rate. Number 5, if you're caring for a child whose school or place of care is closed due to COVID-19, I know we all know there's no school in Texas anymore right now. It's done for the rest of the year. If you have an employee who maybe is a single parent, and because that school's closed and any after school programs are closed, they have to stay home to care for their child, then they would be eligible for that 2/3 pay rate for up to 80 hours. Keep in mind though, if they're able to still work from home, they're eligible for their full pay. So while they're home caring for their child, they may be able to telework. So you need to really take that into consideration. And if they're able to telework, they're not going to have to use any of this paid sick leave because they will be working from home. And Abbott is urging everybody to be as accommodating as possible, that if your employees can work from home right now during this stay-at-home order that expires on the 30th, please let them. Number 6 is funny. I always tell people to ignore number 6 because so far I have not heard of any situation that qualifies under number 6. The Secretary of Health and Human Services and the Secretaries of Labor and Treasury have not issued any order requiring people to stay home for any reason. The only thing that I could consider would be the Secretary of Health and Human Services coming in and saying, hey, we're shutting this nursing home down temporarily because you know those are hot spots right now. That hasn't happened. But even then, when a work site is closed, you don't have to pay sick leave. If the work site is completely shut down or your employees are furloughed or laid off, then they're not going to qualify under this unless they requested it beforehand, and then they will be paid up to the date that that work site did close. So moving on, so the duration of leave. Like I said, a full-time employee is eligible for up to 80 hours of leave, and that's going to be 80 hours at your regular pay rate. For instance, say somebody, well, you do kind of have to factor overtime into this sometimes, but with regards to calculating a part-time employee, they're not going to be eligible for up to 80 hours. They're going to be eligible for what their average time worked is over the last 6 months. So say they're working 20 hours a week for the past 6 months, then they're going to be eligible for up to 40 hours of leave. So that's real important in knowing those calculations. Now, all the different reasons, 1 through 4, that we went over are going to be at the regular rate. Now, number 5 is going to be paid at the 2/3 of what their regular rate was. And also, if you look, 1, 2, and 3 is going to be paid at the regular rate for the 2-week period. And reasons 4 and 6, 4 is going to be the one where you're caring for a family member as their primary caretaker, and they really broadened the definition of family member. Number 5 is going to be caring for your child, and it has to be your child by adoption, court order. That's going to be paid at the 2/3 of your regular rate of pay. And number 6, which is in the middle there, I'm not even going to mention it because, like I said, I've not even seen that come up as any situation so far. And they've given no clarification on it on the Department of Labor website for what it means. So for the full-time employees, let me go into now what the Family Medical Leave Expansion Act is, just to give that broader definition. The only people that qualify for this additional 10 weeks of leave are people who have to take time off of work to care for their child because a school or daycare facility is closed due to COVID-19 and there's nobody else that can care for their child. That is the only reason that qualifies for this expanded family medical sick leave. If you have an employee who takes off their 80 hours because they have COVID-19 or are under quarantine, and then they continue to be sick after that, they would qualify for regular FMLA, which is unpaid. So then you would go and follow your company's normal FMLA, which, as we all know, that's going to be limited in what your employee count. It's got a higher threshold of employees, and you have to have been working for the company 30 days prior for the emergency family and medical leave expansion, whereas there is no time limit for the emergency paid sick leave. So for part-time employees, I did touch base on that. You want to look at the previous 6 months to find the average weekly or average daily hours, and that's how you would calculate the amount of time available for them to take off, because they would not be eligible for the 80 hours. And keep in mind that this 80 hours is available from now until December 31st, the end of this year it expires, and it's for anything COVID-19 related on the list of 6 reasons that I showed you previously. So they do set monetary amounts on how much people can be paid during this time off. And this is important to note because what they're doing is they're offering dollar for dollar tax credits. If you pay over the amount that's specified on a daily or the weekly basis, then the amount that you paid over that would not be eligible for the tax credit. Some employers are choosing to, if they send an employee home, to go ahead and just pay them. Well, that would not be eligible. It doesn't necessarily mean that it's one of the 6 reasons related, because the employer just being on the safe side and sending them home. The CDC has come in with guidance on this now and said, if you have an employee that's had exposure to COVID-19, you don't necessarily have to keep them at home. As long as they're asymptomatic and they're not showing any signs of a fever, then they can continue to work, practice social distancing, sanitize the work areas better. Don't allow them to congregate in break rooms together. Don't allow them to eat lunch together. Social distancing is really what's important right now. So I guess really the most important thing now is that people I know are going to have specific questions based on situations they've had occurring in their workplace on, does this person fall under FFCRA? What do I do if an employee has been exposed? And I do have some frequently asked questions we can go over. I'd like to answer any questions that people have. I already had some questions sent in to me that I would like to go ahead and go over. One of the questions was, has it been determined for reason number 6 what experiencing any other substantially similar condition is? And the answer to that was no. I have not yet seen an example or anyone that would qualify under that. Another question was, what if an essential business and employer has employees that are afraid to return to servicing the retail stores they're responsible for, and there's no telework for them to do? Well, unfortunately, fear is not a qualifying reason under the FFCRA. If the employee is in a high-risk category, as a best practice, you should accommodate them and allow them to stay home. I would say as a best practice, you need to get the request in writing along with the reasoning. Unless they have paid time off to use or the company chooses to pay them, then this would be an unpaid leave. You would want to defer to your policy manual on leave of absence and follow the guidance and rules there. Keep in mind, though, that monies paid that do not fall under FFCRA guidelines are not eligible for the dollar tax credit. Just reason number 2, which is a healthcare provider ordering you to self-quarantine, include the high-risk employees that have underlying conditions but no symptoms or exposure to COVID-19, but they've been advised to stay at home. If a healthcare provider is telling them to quarantine,
oh, there it is. Okay, perfect.
There we go.
Okay, there we go. Okay, had some internet difficulties for a minute. Let's see. All right, Stephanie, anything else you want to cover before going into Q&A?
Yeah, I have a couple more questions that were sent to me earlier that I'm just going to go over. There's 3 more. Basically, if a healthcare provider is telling one of your employees to quarantine due to COVID-19, then yes, ask for the employee to provide documentation, and that could qualify under reason number 2 because they are a high risk. Like I said, if the doctor is ordering them to quarantine due to COVID-19 concerns, then yes, that would qualify under number 2. Someone asked, the FFCRA notice has been posted and distributed to all employees. Is it the employee's responsibility to request the leave or the employer to suggest to the employee they may qualify? The employee should request the leave in writing or verbally. If you are aware of a qualifying event, while not required, you should let the employee know. Here's what you need in order to get a request from the employee. The employee needs to give you their name, the date requested, the reason, and a statement that you are unable to work because of the reason. Finally, what if an employee is granted leave for reason number 2 and then applies for reason number 5? Do they get a total of 12 weeks for both? The answer is they can get up to 80 hours for reason number 2 at their full pay rate, but then they can get an additional 10 weeks for reason number 5 at 2/3 of their regular pay rate to care for their child due to the closure of a school or daycare from COVID-19.
Okay, let's see. I think we have another question. Okay, so Stephanie, there's another question about if you have a laid off employee, but you have received PPP funding, do you have to start paying your employees upon funding, or can you wait until the stay-at-home is lifted and then start paying them?
Well, it depends on if you're an essential business. So if you're an essential business, you're exempt from the stay-at-home order. The essential business listing is actually fairly broad. If you support an essential business, you can also be deemed an essential business. So in order to stay qualified for those PPP funds and having the loan forgiveness, then you want to bring them back as soon as possible. And actually, I would recommend talking to a tax professional because the IRS has given guidelines on, and I did include a link on one of the slides to the IRS guidelines on documentation to show what you need from employees that are coming back to work, because they will require proof and there will be audits. So I did include a link on that.
Okay, perfect. And we'll make sure everybody has access to the slides after that attended. There's another question from Stephen about an employee took 2 weeks off out of concern of potential exposure and claimed they spoke to a doctor over the phone. We suggested multiple times to get a return to work form in writing, which they did not. It's been 14 days with no symptoms and they are now able to come back. Would they qualify with nothing in writing from a doctor?
I would say no. You would need something. Even if somebody teledocs, multiple employees are using teledoc instead or going into urgent care clinics, and they're able to get documentation from that teledoc stating, yes, I did require that person to stay home, or no, I didn't require that person to stay home. So they need to bring in some sort of documentation, because what's going to happen is monies that you pay them, if you don't have proof, then you are not going to get that tax credit. So you want to ensure that you're able to get that dollar for dollar tax credit.
Nice. All right, so there's another question asking, can you recap about working if an employee was tested and can continue to work awaiting test results? Did I hear this incorrectly?
No, so say an employee, normally they're really not doing much testing unless you're actually showing COVID-19 symptoms. That's changing as more and more pop-up drive-through testing places are opening and more local doctor's offices are offering the 15-minute testing. If you have come into contact, you have a duty to report to your employer that you have had contact. At that point in time, your employer can monitor for you for symptoms. We recommend, the CDC recommends, checking employees' temperatures at the door. Normally this is considered a medical examination. However, during this pandemic event right now, it is 100% allowable to check your employees' temperatures before they walk in the door. The CDC says a temperature of 100.4 is going to be a red flag. However, as a best practice, running any type of temperature, we would recommend that you would send that employee home anyways, because that's displaying a symptom. But as long as they're asymptomatic, the CDC has no problem with them continuing to work as long as they're practicing the social distancing. And I'm sure you've seen videos on TV where they're showing people in machine shops and warehouses working, and there's no social distancing occurring. Well, Houston, I know the city of Houston has already come in and shut one business down because of that. And it's a huge manufacturing company. So companies need to take it seriously, because if you become the grounds for an outbreak and they come in and you are deemed a hotspot and they see that you have not made your employees practice social distancing, they'll shut you down. You could face monetary fines. You could face potential OSHA citations. So it's really important that people practice social distancing.
So next question, oh, go ahead. Was there? So next question is from Melissa, and it says, once the 12 weeks pay is over and for reason number 5, if they do not return to work, we are not required to pay any more, and would we be able to rehire the position?
Correct. You're under no federal obligation to maintain that position as being open at that time. Also, if an employer has an employee that has to be out and the employee has not worked there very long, you do not necessarily have to return them to the same position either. Unlike regular FMLA, where it has to be a equal type position, under the emergency one, you do not have to if they've not been employed by you very long.
Okay, so there's another question about, I've had 4 employees leave due to not wanting to work during the pandemic. If I rehire them, do I have to back pay them?
No, none of this is retroactive. They made that very clear that nothing in this act is retroactive.
Awesome. So there's another one. I am in a real estate office, residential services. We have been open this whole time. An employee has requested to work from home and does not fall under any of the qualifying events. We have required him to use half his PTO for every hour he works from home. Is that okay?
No. If he's working from home, he has to be compensated under FLSA and Texas payday law. You cannot require him to use his PTO if he's actually working. What we recommend doing is at the beginning of the day, having the employee check in via email or text message, having them send an email at the end of the day, recapping everything that they did throughout the day, maybe even unit of time increments showing how long it took them to do stuff to justify that they're working from home. But if they're working from home, you can't dock their PTO.
All right. So there's another, it says, we were granted the loan and now we're having issues with some of our employees wanting to work. We are following the protocol to disciplinary them, then terminate. Can we hire to cover that position?
Are they not, if they're not wanting to work because they're scared to be around people, if they're deemed in a high risk category, I would say do your best to accommodate allowing them to take just time off under a leave of absence policy, unless they were able to get a note from a medical professional stating that they needed to self-quarantine due to COVID-19 concerns. But if they're not wanting to work, just because they have a fear, like I said, fear alone is not an excuse. As the employer, offer them face masks, offer them, you know, as much social distancing as possible, allow them to work from home if possible. I know that is not always the case, but if somebody straight up refuses to come into work, you can start the progressive disciplinary process up to and including termination, and you can replace that position.
All right, so another question, okay, let's see, it's coming in the chat box here. So if we have employees that were getting 40 hours a week prior to PPP and are paying them for 40 hours, even if they don't work, what do you do for those that are taking advantage knowing that they're going to get paid for 40? Also, did I hear that no overtime is covered under the PPP?
So with regards to the PPP, things relating to that really need to be answered by a tax professional, because that affects your tax liability, your loan repayment, or your loan forgiveness. Because at the end of the day, the document and paperwork you're going to have to provide it to the bank, they're going to need to advise you on what that is.
Okay, and we might have already covered this. It said, maybe we already answered this one, but do we need a doctor's clearance for someone to come back to work while they self-quarantine themselves due to being exposed to someone who was exposed to someone else who was positive for the coronavirus?
You, as an employer, are allowed, when an employee is out sick, to request a doctor's release to return to work. I would say even more so during this pandemic.
Okay, let me just make sure. Remember, I think there may be a couple of more. Should we require all employees to sign a COVID work protocol so that we don't get sued if one of them gets COVID, whether work related or not?
Well, signing a COVID work protocol is not going to prevent a lawsuit. You can't waive your right to file a lawsuit if you feel your company has put employees in danger for whatever reason. So if you as the employer are monitoring people not abiding by the social distancing practices and things of that nature, they're not cleaning up, they're not being hygienic, then absolutely, I mean, that's going to fall on the employer. So you should use disciplinary action if people are not following the rules and regulations and what the CDC guidelines are recommending. But you can't sign away your right to sue a company.
Okay, and so is there a limited number of employees able to work if the business is necessary or if the business is an essential business?
It's gonna vary company to company based on what the essential business is and what is being done. If you're a company that has 5 employees and 3 employees are going to be out, you're going to be able to show a financial hardship there, and you cannot. And I would say under that, you'd be justified in denying any of the FFCRA to them. The closer you are to 50, the harder you're going to have in justifying that it's a financial hardship or an undue hardship for the company.
So what if you have an employee who states they want to get fired because they can get more money from unemployment pay? Can you fire them, and are you required to replace them if you had gotten PPP funds?
Well, with regards to firing an employee because they don't want to work, I would actually request that they turn in a resignation and say that they have a fear of coming to work due to COVID-19, and then they can apply for unemployment benefits. But you can't really fire someone because they say they want to be fired. They have to do something, disciplinary wise, that you can start the progressive disciplinary process on, such as them not showing up for work or calling in and violating the attendance policy. If you have like only 3 absences allowed, per month, and they call in 3 days in a row.
So what do we do if we don't have a source to buy face masks and an employee requests one? That's a good-
Well, the CDC gives guidance on their website on how to make your own face mask. So they don't have to be an N95 or a surgical mask. Those masks need to be reserved for the healthcare professionals because there's currently a huge shortage in those masks, despite what you may hear in the media. You know, I know locally there's a huge shortage here. You can make it out of cloth, you can make it out of a bandana. The CDC actually gives you on their website how to make 3 different types of masks yourself with step-by-step directions.
Okay, great. And so our employees were hired at a minimum of 48 hours, which include paying them overtime. Many times they worked more. Will the PPP grant covering those hours, or will the PPP grant cover those hours, or should I keep them at 40 hours?
Honestly, you're really going to need to look in the provisions of the PPP and talk to a tax professional.
Okay. And then someone asked, so who is responsible for those masks? See, the employee, is it the employee or the employer that's responsible for those masks?
If the employer is requiring the masks, the employer should provide the masks.
Okay. And so I'm being told that here at HRO, we actually may have a source that can help find some of those masks and also temperature strips. So feel free to reach out to me directly after this, and we'll see if we can get you guys some help as it relates to obtaining those masks.
Yeah, we do as well. So
Awesome. Good. Okay. So if an employee does not report to work as scheduled and calls and says they are not feeling well, can the employer tell them not to report to work for 14 days or request a doctor note before they can return to work? We do check temperatures at the door.
they can request a doctor's note to return to work. I don't really think an employer can say you need to quarantine for 14 days. That needs to come from a healthcare provider or come from, you know, federal, local, or state quarantine order. But they really need to seek, like I said, teledoc is the easiest way. You can get in to see a doctor. Somebody that says they can't get into the doctor, well, I find that hard to believe because there's so many teledocs available.
Okay, so I think that's about it for questions at this point. So we'll wrap up the Q&A for now. If you guys have other questions and that come to your mind after this, feel free to reach out to me, reach out to Stephanie. We'll make sure you have all of our contact information so you can reach us directly and continue asking your questions. We're going to keep doing a lot of these webinars. We've got some upcoming webinars. I think the next one, I believe next week, will be on commercial leases and landlord negotiations. There'll be one coming up on virtual leadership and then one coming up on business interruption insurance. So we hope to see some of y'all back for those webinars, and we want to hear from you. So if you've got ideas on topics that you want to hear about during this time, things that we may be able to help you with, please get those to us. You can reach out to me directly. See if I can get my contact information up here. And I can get you connected with, with Stephanie or some of her team if they can help. And, we'd love to be a resource for you. So we really appreciate all of y'all attending today. Thank you, Stephanie. You did a great job. Thank you all for the questions coming in. Made for some great Q&A. This is critical information, and we really appreciate you guys bringing it to us. So thanks again. Our contact information is here, and we'll make sure that all of you have access to the slides and information from today's presentation. And you guys have a great rest of the week.
Thank you, you too.
Thanks, guys.